Thank you for the opportunity for the TAB give a talk on the perspective of surgeons' career. I don't know how much of the knowledge you got from up to now. So you all have done finally appointments, all 4 components, and you all have listened to some talks. So most of the stuff about the MD course and the pediatric course carriers, medicine course carriers, some steps are almost same for each and every career. But when you are selecting a career, you have to decide yourself from now. Then only you can prepare yourself during your internship. Then you can go for the exam after 1 year completion of your post-intern period. So, what do you think about the surgical career? Any idea? Is it easy? How many of you say is it easy? No one. Okay, I'm happy. So, each and every career, it's not easy. Because you have to do your job perfectly. Otherwise, you won't get a satisfaction in your life. So, when you are selecting a career, as everybody said, you have to believe that you can do it until your retirement of life. That is the most important thing. Because each and every career there is a 24 hours on call. So we are responsible for that. There's no doubt. But when we are struggling and doing the things, we have to like that field. Then only we can do our job perfectly. Otherwise, halfway we'll drop and go. Isn't it? So, in the surgical field, because everybody said surgeons are the most attractive person in the medical career, but I'm not quite sure that is true or not. But because in other field, you can make either medicine and see like that. But in surgeon's life, you are taking a decision. You are going to operate in a patient. So you have to think twice whether this decision is correct or wrong, and whether this decision will affect the family or the patient. So we have to be careful and make sure there won't be any complications and improve the patient care and the outcome. So that is the most important thing in the surgical career, because there is no second time. There are second times we can do, but we can't take the decision always twice. Okay? And before we are selecting the career as a surgeon, first we have to go through, because initial part during the once you finish your internship and post-intern for after 1 year, you can do the exam. But first exam, there are 2, part 1 exam and the part 2 exams. The part 1 exam, there will be a MCQ and the OSCE. But main, that for MCQ, you have to study the same thing what you have studied in the second MB and the third MB, part 1 and part 2. So anatomy, you have to be thorough. And pathology and the physiology. So anatomy, actually when we study the second MBBS, we are so fluent in anatomy. But when we are coming to the final year, I have checked most of the students don't know the anatomy. So, but anatomy is you have to know for your lifetime. There is no second question. Because each and everything, even when you are doing the medical career and when you are doing the blood gases and all, you are taking the arterial blood gas, you should know where is the artery is going. Then only you can do the ABG. So anatomy is so important. So when you are doing the final year and that time you might forget about the anatomy. But A to Z you should know, like secondary years, you have to study again. So that will take some time, but you have to spend more time on the anatomy. And the physiology and pathology, you have to, but that is fine. You can study more hard, but you have to study. So after the part 1 exam, initial MCQ, once you go through the MCQ, you will have the Viva exam, okay? So if you go through that, then you are selected for the MD training. So this MD training period from part 1 to part 2 is 3.5 years. So you will do the appointment with each and every subspecialty of the surgery. So during that time, you can decide which subspecialty you want to do. So that time, just only 2 months or 6 weeks appointment, sometimes 3 months appointments. But during that period, when you are doing the subspecialty appointments, you should know about the subspecialty management, and at the same time, you can decide whether you have to continue as a general surgeon or you want to go through the subspecialty. So that is the most important time during your MD training program. So once you finish your 3.5 years, you will have exam MD part 2. So there are theory paper exams, short case and a long case, and at the same time there will be a Viva and OSCE. So those components you have to go through. Then you can, once you finish your part 2, then you can decide on your subspecialty. So even though I am a pediatric surgeon, I have gone through all the general surgical careers. After part 2 only, I have decided to select pediatric surgery. But orthopedic and ENT surgery, usually that was separated from after part 1 exam. So usually those ENT surgeons and the orthopedic surgeon no need to go through the general surgical career pathway. So that is separate, and the general surgical career pathway is separate. So when you are going to select ENT or not, you have to decide before your part 1 exam. Okay. So then after part 2 exam, the subspecialty, depending on, because in surgical career, even general surgeons also have to do 2 years of the local training, and subspecialty surgeons also have to do 2 years, and but cardiothoracic surgery 3 years local training. So during that local training period, for the general surgeons, now they have to do as a general surgical one, at the same time they have to do some subspecialty part. So general surgeons with special interest. So it could be vascular, it could be colorectal, it could be endocrine. So they have some special interest on subspecialty. So after that, they have to work as a general surgeon, so they can develop their career with the subspecialty interest. So 2 years local training and overseas training, 2 years, 1 year compulsory, but extra 1 year you can stay. So as usual, everyone said, once you finish your MD post overseas training and started your job here. If you select your subspecialty, then you can work in a tertiary care hospital because all the major subspecialties are in tertiary care hospitals. But general surgeons, they will appoint different hospital everywhere in Sri Lanka, base hospital and teaching hospital and general hospitals. So they have to go on rotation every 4 years. So actually not only every 4 years, after 2 years they can apply and transfer. So wherever you go, wherever you work, when you are taking a decision and to be a surgeon, you should prepare yourself because when we are operating, we don't know what time we could finish the surgery. If it's a minor surgery, yes, you can decide. 15 minutes, 20 minutes, up to 1 hour, you can finish your surgery. But if it's a major surgery, you have to operate more than hours and hours. So you can't eat, you can't drink, you can't go to the washroom. You have to control yourself and you should have that self-confidence. So each and every time you have to think about the complications when you are operating. When you feel, I'm tired, so I can just finish it off this like, why I have to do one more suture? It seems okay. So when you think like that, you should think about what will happen next. So those things you have to develop during your training program because stamina is so important. When you are doing the retraction, you have to retract. There is no question. I am tired, so can I leave some time? No. It's a patient life. When we are dissecting the artery or something, just leave the retractor, what will happen? So that is the most important part you have to consider when you are doing the assisting and when you are operating. And one more thing, because I'm telling, you all are listening, so other people are telling. But when you are started and decided to do surgery, you have to go and do the surgery, assist the surgery during your internship. Because I'm so sad to say, but I have to say, after finish the surgical internship and coming to the as RHO, most of them, they don't know how to clean and drape. That is the most basic thing everyone should know. As you have finished your surgical internship, those things are developed from the observation. You don't need to go and do, but you have to observe. Most of the things you can learn from your observation rather than reading the book, rather than telling someone to you. So that skill is important for any career. Without observation and listening, you can't develop your skills. Skills are so important. Minor suturing. Don't think just clogging the patient is enough during the surgical intervention. You have to try to do something. Ask the researchers. Ask for a chance. Then you know whether you can continue or whether you can decide your career as a surgeon or not. Those are the important things before deciding the career as a surgeon. Because these skills won't come just with the words, just with reading the books. Skill will come when you are doing, practicing. Practice is so important. You all heard there are laparoscopic surgeries, minimal access surgeries. So, how many of the surgeons, how many of us are doing the things, how many of us are like to do the open thing. Those are depending on the skills. It doesn't mean that they can't do or they don't want to do. Because when you are doing your career, you can decide which one is suit for you. Whether I am skillful with the laparoscopy. So you can decide to select surgeries with the laparoscopy. So those are depending on the skills. So during the surgery career, important thing, decision making and the skills. So both are important to improve your career, and at the same time, you have to decide these stuffs when you are doing your internship. So internship is the most critical period to take something and go on. How many of you, I just want to ask, I'm not pushing you, how many of you like anatomy dissection during your second MBBS? This one? Okay, that's good. When you like the anatomy dissection during your second MBBS, I hope you all like the dissection. That means you like the surgery. But because anatomy dissection time, each and everything, artery, vein, muscles, and everything you all are dissecting. If you have confidence and if you have the tolerance only, you can do that. Because I know, because from our batch and my experience, I'm telling, 1 or 2% will dissect. Rest of the group will come and see. So half of the group build a book. They are keeping and reading, and one is telling the stuff what are the book says. So end of the dissection, everyone will come and see. But 2 or 3 people will do the dissection, isn't it? So I don't know, that will help for the anatomy part. But the people who like to do the dissection, they have the capability to select the career as a surgeon. That's my opinion, but it's not true. Okay? Any questions? Rest of the stuff for the post-MD training part, everything, everyone has said. So I don't want to tell those stuff again and again. But one more thing, when you are going for overseas training, they are so keen for the surgical part and they are so keen with the medical legal aspects. So when you are doing the surgeries, you have to take proper consent. So you learn to develop the skill during this internship period, how to take a consent properly. That is the most important part for the surgery. So that is the most important thing they emphasize during your office training. And wherever you go, you have a job. There's no doubt. But you have to show that you have the skills. Then you will survive there. Okay? Thank you for the opportunity. Thank you for the listening.